Hello everyone, you're welcome. And as we promised, today we are going to talk about antenatal care. Very many mothers go for antenatal care in Uganda here, and they don't know what the doctors expect of them and what antenatal care means. So today we are going to see what antenatal care is, what we expect out of the mother, and what the mothers should expect out of us in antenatal care. So what is antenatal care? This is the care that is given to the mother right from the time they feel they should get pregnant up to the time of delivery. So that is basically considered as antenatal care. And why do we do antenatal care? What are the aims and objectives of antenatal care? So antenatal care is aimed at one, having a safe and good pregnancy, planning and having a safe delivery, having a healthy mother, and screening and preventing complications that may come with pregnancy and delivery. Basically, that is the basis of what we can call antenatal care. So, how many visits do you expect in a mother? Previously, we used to recommend 4 visits for the whole of pregnancy, but currently we need a minimum of 8 visits during pregnancy. And the first visit should be when you intend to be pregnant. So you either come before getting pregnant, and that will make 9 visits, or you come when you're pregnant, and that will be 8 visits when you come, 1 visit per month from the time of knowing that you're pregnant. What happens when you come to the facility? Or why should you go to the hospital for antenatal care? On the first day when you come and you visit a health service provider to give you antenatal care, they do the following, and I want us to understand why they do this, such that we can maintain a very good antenatal care program. The first one is we do what we call booking. Booking is taking you and you start antenatal care, and we do the following in booking. We take what we call your booking blood pressure, or the first blood pressure that we take when you're pregnant. The second one is the booking HB. We know the volume of your hemoglobin the day you decide to get pregnant. The third one that is mandatory is taking your weight. And we are going to look at why are we interested in all of this. So one of the biggest challenges that very many women face include preeclampsia and gestational hypertension. These are the conditions that you get due to pregnancy, and they affect your pregnancy. So gestational hypertension is the hypertension that develops after 20 weeks of pregnancy without any signs of a condition called preeclampsia or eclampsia, which we shall discuss in our preceding videos in regards to maternal child care. Those will be the complications that come with pregnancy. So when you come, we screen and we use it as a baseline. The next time you come in our hospital or in any other hospital, they take blood pressure and compare with your first blood pressure when you were pregnant. The second one is called the booking HB. HB means your hemoglobin levels, and those are the molecules that carry oxygen within your blood. When hemoglobin is low, you cannot have a very healthy baby. And when you get pregnant, the body uses your nutrients to produce both your nutrients, both your hemoglobin and the baby's hemoglobin. So When you get pregnant, your hemoglobin levels are affected. So, and also the volume of your blood increases, and you get some conditions like dilutional anemia. So when you get pregnant, we normally want to monitor your hemoglobin, because we know that at a given time T you must bleed, and when you bleed and lose more hemoglobin, we might lose a life. So we do hemoglobin estimation in pregnancy, in early pregnancy, and we monitor it throughout pregnancy. So after booking you, the intention of antenatal care, the first visit is you're supposed to know what we expect out of you. And part of what we expect out of you is we are supposed to screen for diseases that are vertically transmitted from you to the child. 2, we are supposed to screen for diseases that might cause abortion that is unintended. And 3, we help you supplement on what your body needs. 4, we prevent the diseases that can also cause abortion apart from treatment. And 5, we prepare you for delivery. So, apart from all that, during antenatal care, you're supposed to know how you're supposed to feed in pregnancy. And when we go down, the following diseases must be screened in pregnancy, and this will include malaria, since it can cause abortion. And if malaria is negative, for the first 3 months, you sleep under a mosquito net only, but in the second trimester and the third trimester means 3 months of pregnancy, I will give you fancy that prevent malaria. So when you're pregnant, still your immunity is low. So when you reach the 3rd month of pregnancy, we normally decide to give you albendazole, prevent worms that may affect you when you're pregnant. Apart from that, we know your blood pressure and we monitor it throughout pregnancy. Still on the first visit, we are supposed to screen for HIV, hepatitis B and C, syphilis. We are supposed to screen, we had said malaria. And in the early pregnancy, we're supposed to screen for urine. In the early pregnancy, we are interested in UTIs in urine. So in the first visit, you're supposed to be educated how many times you're supposed to visit the facility, and we are supposed to know what we are supposed to eat in pregnancy, and we plan for the pregnancy. In the second trimester, after we having the initial visit, we start screening for chronic diseases that come due to pregnancy. And part of that is gestational diabetes. This is diabetes that will come in after 20 weeks of gestation in a previously normotensive person, or in a person who previously did not have diabetes. We screen for any other complications like preeclampsia. So we start looking for the proteins in urine, and also monitor continuously your blood pressure. So in the second trimester, you start receiving drugs that are going to prevent you from getting diseases and also preventing the baby. You are supposed to be taught the danger signs in that trimester, and the danger signs will keep changing according to the trimester you're in. And towards the end of our second trimester, we start doing what we call a birth plan. It's a very wide topic, and that is part of the things that we must discuss in our proceeding videos. How do we prepare for the delivery? what is the birth plan, what do I go with, and how do I choose where to deliver from. Still in antenatal care, towards the end, we also try to understand why would someone have a normal delivery and why would someone go into a cesarean section delivery. We are supposed to know all of that in our antenatal care because decision making is very important and very vital in pregnancy. So you are required, you as a mother and the father of the child must know when the doctor decides consent you to go for a surgical delivery other than a normal delivery. In the preceding videos ahead, we shall also sometime discuss what would cause a cesarean section and why would two people go in labor, one delivers normally and another one ends up in a cesarean section. So basically in antenatal care, we are supposed to equip ourselves with knowledge to make us masters of pregnancy, understand pregnancy, challenges that might come with pregnancy, and why we should always visit antenatal care. So in our proceeding videos, we shall be seeing key things, detailed diseases, as we have discussed in this video. Thank you so much for tuning in. We promise to give you authentic knowledge that will aid you very well through your health, starting from maternal child care this time, as we move forward, supporting in other health programs that will be coming ahead. Thank you so much for tuning in.